Pulsate's mission is about helping people live independent and healthy lives. We do that by using data in very different and unique ways and facilitating that data through advanced analytics at the point of care. So we at Pulsate understand that there's lots of information around our own health and our own interactions with our providers. And that information spans many years. So today, as we know, when we go to see our doctor and he or she asks us certain questions about tests that we may have had in our past, that information is not readily available. And we bring that information direct to the consumer and direct to the doctor. Pulsate's business is important to Maryland because we are helping Marylanders obtain better care. We believe you cannot dream big enough when it comes to data and supporting our healthcare delivery system. Our goal is to drive and improve better forms of care for all Americans.
Dinner Time is an amazingly personalized meal planning and shopping app which helps you save time and money, and most importantly, helps people eat the way they intend to eat. Dinner Time takes into account all of the families, all of the household's unique attributes. Its size, its time constraints, its budget, its tastes, allergies, health concerns, skill level of the cook, and all of that together with what's on sale at the store that you wish to shop. It suggests you a smart meal plan that takes all of that into account. There have been countless studies which show the importance of the meal experience as a family in terms of boosting children's self-esteem, performance in school, lower drug and alcohol use. And for the adults in the family, it's critical to their sense of work-life balance. The magic that happens is that Dinner Time computes all of that and creates delicious meal recommendations that perfectly suit your family.
ClickMedix is born out of MIT Media Lab as a way to serve over 1 billion people and provide them with better access and better affordability of healthcare. We use mobile and web technology to enable the devices like these ones to collect patient information, symptoms, images, and videos, transmit them securely to doctors so that they can spend their time on the diagnosis and treatment planning, and therefore saving time from data gathering. In one of our deployments, we work with Medtronic to screen for ear infection. We screen about more than 1,000 patients per week, and we've doubled the number of patients who can get treatment at our partner hospitals who otherwise may become deaf. Years from now, I hope ClickMedix is the one-click mechanism for patients to get the best health care they can.
ZeroFox stands uniquely at the intersection of cybersecurity and social media. Both are unbelievably booming industries right now, and we believe they've created a cross-section of risk for enterprise organizations. We're helping those organizations identify, manage, and mitigate the risk associated with social media in the enterprise. A lot of technology company CEOs, when talking about what makes them unique, would say their product or their technology or their intellectual property. My answer will always be people. Our people make us unique and give us our biggest competitive advantage. Over 90% of global businesses today use social media. Our goal is to help those organizations protect their social attack surface. We treat our customers like they're our grandparents. We give them lots of time and attention. We know that customers are a finite pool out there, and we want to make sure that a customer of ZeroFox is a customer for life.
LightPoint Security is a first mover in a new category, which is the isolation-based security space. And what we do is, instead of trying to determine if something is malicious or not, we assume everything is malicious and we move it into an enclosed environment where if there is something malicious there, it can't get out and it can't harm you. For decades, the computer security industry has been focused on the idea of detection. And so the concept or theory there is that they use some sort of algorithm to determine if what's coming into your system is malicious or not. The problem with that approach is that there's just so much new viruses that are being created every day that it makes it impossible for these products to keep up. Maryland has such a vibrant cybersecurity community here. We have access to great talent, cybersecurity talent, as well as programming talent. I'd like to think that LightPoint Security is known as being on the leading edge of the next wave of cybersecurity, in which we can protect you from both known and unknown threats.
Luminal is a cybersecurity company providing intrinsic security for cloud applications. Luminal is unique for a couple of reasons. First of all, in cybersecurity typically brings additional restriction on how you develop applications. It's costly, it's inefficient, and difficult to use. We actually simplify deployments in the cloud instead of making them more difficult. From a security standpoint, most systems are trusted until proven otherwise, but in fact, most people don't know when they have been exploited. So with the Luminal solution, we solve the problem whether it's detected or not, and we do this by using successful patterns from nature and biology. We chose Maryland because Maryland is committed to cybersecurity. We have the right business community, educational institutions, and talent for a company like ours to thrive.
We started Harpoon Medical because of a vision of Dr. Jim Gammey. Dr. Gammey is one of the leading mitral valve surgeons in the United States and just sees the invasiveness of the procedure and what patients go through, and a lot of patients who are not able to get a procedure today because of the invasiveness of the procedure. The uniqueness of Harpoon Medical is the device that's being created to do minimally invasive mitral valve surgery. Today, mitral valve surgery is open heart surgery, where you have a large sternotomy. Your heart is opened up, your chest is opened up, your heart is opened up, and the surgery is done on a non-beating heart, so you're put on bypass. Our device, we're going to do a small thoracotomy, a small incision just below the breast. Your heart will stay beating, and the surgery will be very quick, under an hour compared to 5 hours today. Our vision is to take a very complicated open heart procedure to a very less invasive procedure that can be done in less than 1 hour, send the patient home the next day, and get them back to work in under a week.
BrainCentury was started to address a real problem with sports, and that is that kids don't admit it when they're suffering the symptoms of a concussion. So we don't know who has a concussion. So that's why we need sensors like the BrainCentury sensor to figure out which kids need to be assessed for a brain injury. Concussion diagnostics is a real problem right now because we're so dependent on self-reporting of symptoms, and the kids, they want to play, so they don't admit it when they're suffering from the symptoms of concussion. So it's a big problem, and that's what BrainCentury is trying to fix. What makes BrainCentury unique is that we've come up with a very low-cost method and very easy-to-use way to figure out which kids took the big hits to the head, and so we know which kids to assess for concussion. Our vision with Brain Sentry is to reduce to the greatest extent possible brain injuries that are experienced when children want to play sports like football and hockey and lacrosse.
Optic Medical is an early stage medical device company focused on helping primary care providers prevent blindness in diabetes patients. The existing technologies are really focused on diagnosis of the disease in ophthalmology clinics. So they tend to be expensive, they tend to be bulky, they require training to use, specialist training to use. So our technology is shifting the paradigm from a physician-centric model to a patient-centric model, and by bringing the technology to the patient and positioning it in the primary care provider's office, in a pharmacy, in a grocery store, wherever a diabetic patient would have a touch point with the healthcare system. What we bring is patient access to important eye care. It would be great if Optic Medical could deploy its technology throughout the United States and in developing countries that are plagued by diabetes. My co-founder Abhishek Rege and I are passionate about developing medical technologies and bringing technologies to market that can help people.
Stack is like an air traffic control system for your digital media advertising. It lets you track the performance of your ad campaigns as they run across the internet. What makes Stack unique is that we're integrated with over 150 different advertising technology platforms. This industry is moving towards real-time advertising, and everyone is still beholden to Excel spreadsheets and pulling data down from so many different sources that it's still very cumbersome and a lot of work to do what you need to do on a daily basis. If you're an advertiser or publisher today, you have to go to Google and Facebook and Twitter and countless other systems to manage your digital media operations. And it's by using Stack, you can pull together all of the systems together into one interface. Stack chose Maryland and Baltimore specifically for its rich ad tech talent in the area.
Foodum is an online trading, business intelligence, and process automation solution for the $650 billion a year U.S. food distribution industry. So in essence, we are an online marketplace that connects food distribution companies, small local farms, and specialty manufacturers with wholesale buyers such as restaurants. Buyers, for the longest time, for the last 5-6 decades, have to pick up the phone or meet a salesperson to compare prices between multiple distributors and place orders. Now, with a one-stop shop, kind of like Amazon for food distribution, they can get on our website, compare apple-to-apple prices on multiple products, place orders simultaneously with multiple vendors, and POs are sent out automatically to these vendors via an email, and they get their delivery the next day. For our vendors, we help them increase their market cap, so now they can get hundreds of restaurants buying from them electronically through our website and at a much lower overhead. So they don't have to rely on a large sales team to go out and get these orders for them. We get them these orders without the overhead of a sales team.
Healthify helps Medicaid managed care plans improve the quality and reduce the cost of care for their beneficiaries by addressing the social determinants of health. So these are issues like food insecurity, substance abuse, depression, or domestic violence that affect health outcomes and increase the cost of care dramatically. We want to see an increase in the types of services that are offered to these clients with these plans to really improve their health outcomes and to better manage costs as this Medicaid population increases after the passage of the Affordable Care Act. This is a really critical issue, and we want to seek to transform the delivery of this care for these beneficiaries, and we think Healthify has the potential to do just that. Healthify is the only solution that screens patients at the point of care, automatically connects them to the most comprehensive database of federal, state, and local services, and then follows up with them through text message. We would love to help the 975,000 Marylanders who are Medicaid beneficiaries.